Good evening. So today's topic, right, the concept of mandible and hyoid. You'll realize that how good it is by the end of today's session. So before we start, right, this is the official disclaimer that all the images, because today there will be lots and lots of images, all displayed during this medical training session are for educational purpose only, and not all images are suitable for audience of all ages. All right. So let's start with mandible and hyoid. Now, before we start, right, something which we already know, we are comfortable with, because see, this is going to be a long session. We'll be talking about mandible, then from mandible we'll be going all the way to hyoid bone. Not only that, we'll be talking about even the muscles, right, all those muscles, and they are so interesting. They are into some very specific groups. I'm good, right? So this is going to be a long session. And in fact, this is the real start of head and neck. Okay, so here it is. When we talk about jaw, right? We say jaw is sometimes jaws, right? There was a movie also, Jaws. But over here in medical, when we talk about jaws, we say the upper and lower jaw together, right? That is, upper is maxilla, and the lower one is mandible, right? So that's how we call jaws. But when we talk about jaw, that means it's only mandible, right? So that's only mandible. All right. The very important thing which we'll be using today is this, right? That's the zygomatic arch. So keep a focus on that zygomatic arch, because lots of things will be revolving around this particular this particular part. Okay. So here it is. As we know that this zygomatic arch, right, just behind it is, that is this portion. That is what we call as temporal fossa, right? And when we tilt the skull, when we watch from the lower level, right, from underneath, so that one, that is this area, right, that becomes infratemporal fossa. I know we have already talked about this, right? This is just like a refresher. Okay, right. So this is infratemporal fossa. Some important things which we must know over here, right, is this one, right? That would be the TM joint, Temporomandibular Joint, correct? That would be one important thing. Yeah, this is very easy. This is external auditory meatus, right? So that is also easy. And this is like muscular mastoid, because he'll be playing some role today, and this stylish styloid will be playing some very major role today, right? So that is styloid. So that is styloid process, right? They both are process, styloid and mastoid process. You already know this. Today's chief guests would be these pterygoid plates, both of them, right? Both of them will be invited, and that is the medial and the lateral pterygoid plates. Pterygoid plates, right? So they will be playing a major role today. Yes, yes. That movie is over, and in fact, there were so many versions of them. Jaws 2, Jaws 3, right? Okay. Now here it is. This is deliberately the sphenoid bone, right? Sphenoid bone has been isolated for one purpose only. We know that in sphenoid bone, it was like body, right? And then there was greater wing, lesser wing, and then there were those plates, right? Pterygoid plates. Right? That's how we used to learn the sphenoid. In sphenoid, this is okay, right? That's the lateral pterygoid plate. What we need to see is this tip, this, right? This is spine of sphenoid. Just keep in mind, because we'll be coming up with some structures which will be attached over here, right? So at that time, it will be having some importance. Otherwise, rest of the things, they are well known to you. Greater wing, lesser wing, medial lateral pterygoid plates, pterygoid fossa, that was in between. But today, they will all be coming into picture. Okay. Just for revision, right? So you know the structures, right? So you know this would be the TM joint, Pterygomandibular joint, and that is the Zygomatic Arch, right? That is external auditory meatus, Styloid process. This is mastoid process, right? Infratemporal, temporal fossa, and this is the temporal line, all known to you, right? So that is for revision. Okay, yeah. Here it is. Sometimes, right, in real specimen, things are seen very fine. And just for that purpose, this is put this one. See how nicely the spine of sphenoid is seen in this. That's the spine of sphenoid. I'll remove what I drew, right, for the better visuality, spine of sphenoid. So better visual appearance. Let's remove this. Here it is, right? I'll just mark it like this. Okay. So that's the spine of sphenoid, because we'll be looking at some of the structures which will be attached over there, right? Now let's call maxilla. In maxilla, this entire part where those teeth are attached, right? That would be called as the alveolar part, right? Or the alveolar process. Today we'll not be touching the teeth, right? Because those teeth, they will be discussed in a separate session. But just this alveolar process, the point at which ends, right? Over here, that would be called as tuber. Now the thing is, whatever the new words which are coming up today, now every word will be utilized for those muscle attachments, right? And even if you don't remember all of them, no worries. At that point, once again, we'll be revising it. But just remember, tuber is what alveolar process ends here. Okay. So now comes the smiling skull, right? Here we have added mandible, right? We add the mandible. Now see, the mandible is as such combination of two bones, right? Two bones from both the sides, right? From both the sides. So the point where they join, that is what is called as the symphysis, right? That is called the symphysis of mandible. That is symphysis of mandible. So it would be here, right? That is symphysis of mandible. See, one more structure, right? And that is this hyoid bone. Till this point, we have not talked about hyoid bone. Today, we'll be talking in detail about it. Right? Now, say this mandible, we divide it into two parts. One is the body, right? And second, this one is ramus. Ramus means branch. So thus, our mandible would be something like this is body, and this is ramus, right? Right ramus, left ramus, and the body, right? So that's how we see that. Okay. So here is how we look at him in front, and that was the point. That was the point. This is the junction, right? That's the junction where that symphysis of mandible is there. Now let's isolate this mandible, right? Because we want to know about certain things in more detail. One was this body. Body is okay, right? This was what? This was ramus, right? And this in between, that was symphysis. So far, so good. But then there is that projection, right? See, there is a projection. There is a projection. That projection, that is what is called as mental protuberance, right? That projection is called as mental protuberance. Right? And just over here, right? That's the prominence. So you can even feel it. That is mental protuberance. And let's erase this so that you can see this thing clearly. Now see, it is seen fine, right? So I just put it over here. Symphysis you already know, so no worries. That's the joint in between the joint. And the prominence on that joint is mental protuberance. So here is the side view of that mandible. Yes, we removed even all teeth also, right? So here is the body, right? And we know this one was the ramus. This portion, this is the angle of mandible. Angle of mandible. And see, this angle of mandible is rough, right? It is rough. See? And any bone, if it is rough, only when there are some powerful muscles which are attached over there. So over here, there would be very powerful muscle, masseter, right? Masseter. That would be attached. You'll see that muscle. So regarding this, this is what will be forming the TM joint, Temporomandibular Joint, right? Temporomandibular Joint, and it is called as the condyle, right? Or the condylar process. So it is called as condyle. And this one, that is called as coronoid process. So this is coronoid process. Fair enough, right? Everything has got the importance. And this notch, right? That dip, that is what is called as the mandibular notch, right? Notch in the mandible is mandibular notch. Nothing very complicated till this point. If this is head, so then we can call this thing as just a neck. That's okay, right? But important thing which we'll be remembering is that this angle of mandible, right? This angle of mandible is what we'll remember. It is rough and the masseter is connected. And this TM joint, definitely. Right? That TM joint. Rest is all fine. Here it is. We are looking from inside, right? Yes, yes, for both pelvic. There it was called as pubic symphysis. Right. Over here it is mandibular symphysis. So symphysis is where those two bones from both the sides they join. All right. So this is now the inside view. Right. We are watching from inside. And why we are looking at this? Just one purpose. That's the angle of mandible. Correct. That's the angle of mandible. And this is also rough. This is also rough. It means here also there would be some very powerful muscle which would be attached. Yes, it would be, right? And we'll be watching all those muscles in good detail. And that muscle is medial pterygoid muscle. Right? See, the names are also muscular. Right? So it is the medial pterygoid muscle. Okay. And see the prominence. Over there on the anterior side, it was mental protuberance. Here also there is prominence, but it is called as the mental spine. Right? Mental spine. See? Right? Can watch it. That is mental spine. Just a look at it, right? That prominence. Now this particular base, right, this particular body is divided as such into two parts. This one is called as the base, and above portion we have already talked about, right? That is the alveolar part. Right? So it is the alveolar part where there will be sockets for all those teeth. Going into slightly more detail, now this is dead posterior. Absolutely, we are watching it from behind, right? So this is like a posterior view. Posterior view. And in this, two things are to be seen. One, see, there is a foramen, right? That is what is called as the mandibular foramen. Foramen in mandible is mandibular foramen, right? And it would be carrying, in fact, it would be forming a tunnel, right? A bony tunnel. All the way, this particular tunnel will open up in front, right? It will open up in front over here, this one, at this point, right? This is what is called as the mental foramen over here. So that is the tunnel which will be passing through the entire mandible, right? We'll come back to this. So meantime, let's go back. So this is the mandibular foramen, and which will lead to formation of that tunnel. And it is this mandibular foramen which will be carrying inferior alveolar nerve and vessels. Okay. And then interestingly, it happens like one of the branch that would come out of that mental foramen. Okay. So this is one. But if this is the foramen, then there is some projection like this, right? Something like this. Say, if I zoom this portion, here it is. If I tell you to look at this, right? See this one, such a small piece we are talking about. Yes, we are, because this projection, right, this overhanging projection is what is called as the lingula. So we are talking about it, so something must be attached over there, right? So that is lingula. This is that upward projection. Now watch it over here. This would be much easier, right? Because things are properly marked. So two things we'll see: the submandibular, this one, submandibular underneath the mandible. So this is the submandibular fossa, right? Submandibular fossa. This one, right? That one. So that is sublingual fossa. So this would be sublingual fossa. The rest is all known to you, right? Very properly. So because this is what middle one, that one is mental spine, right? That's okay, mental spine. Here we have divided into that superior part and inferior part, but basically mental spine, right? This particular line, right, on both the sides, this is Myelohyoid. So Myelohyoid is one important muscle, right? So this is Myelohyoid groove. That is Myelohyoid groove. That's it. And this one in between is the mandibular symphysis. More as we talk about it. And this one is obviously that what I told you. Remember, it is lingula. Right? Okay. This is from an angle, right? So over here, mental foramen. Through this, that one of the major branch of inferior nerve that would be emerging, right? Rest is all. That's the mandibular notch. We talked about it, right? So this is the mandibular notch, and that is the condyle. That is the condyle, and this is what will be forming the TM joint, correct? And this one is the coronoid process. Coronoid process, so important as it will be giving support to few muscles, right? All these smaller things, that is what is called as the pterygoid pit, in which lateral pterygoid would come, but let the muscle come. At that point we'll see, right? Let's not make it very complicated. Just this prominence over here, remember, this is mental protuberance, right? Mental protuberance. So protuberance is in outside and mental spine was inside. Now here comes our first part. This is TM joint, Temporomandibular Joint, right? TM joint. Now see, TM joint is as such, it's a synovial joint, right? It's a synovial joint. And you know it so well that synovial joint means there are two articular cartilage, right? Two articular cartilage. And then there is fluid in between. And the whole thing is packed with a capsule. And then there is a good movement. True? So we have got the articular cartilage. We need to see that. Okay. Then there will be synovial fluid. All right. Then there would be the capsule, right? And in this capsule, the rule is that this capsule would be very thick if the movement is to be restricted. It would be very loose if the movement is free. So over here, the jaw movement, it is pretty good, right? So that's why this capsule, we are expecting that capsule has to be thin, right? But there is something which is superb about this particular joint. We said that this is a synovial joint, but this is a very special synovial joint. It is double joint, right? What I mean to say, we'll in fact dissect and see that. But what I mean by double joint is, double joint, it means it has got two cavities. See, normal synovial joint has got one cavity, right? This is one cavity, this in between. Correct? This one is in between, is one cavity. In this case, there would be two cavities. And those two cavities, they would be formed by articular disc. So there would be one articular cartilage here. There would be one articular cartilage here. Obviously, this would be in the temporal bone. This would be the mandible part. And in between, there would be articular disc. Correct? Articular disc. And that's how there will be formation of one and two cavities, right? Interesting. So that's how they are arranged. So if we can really see this articular disc, this one, right? This is the articular disc which we'll be interested in. So here is our articular surface of condyle, right? This is like we are watching the mandible, right? This is the mandible, and in this mandible, this is condyle, and that's the articular surface. So this is the articular surface. Now, when we open and close our jaw, that there are two types of movement. One is what is called as the hinge movement. So this is what is called as the hinge movement, right? Hinge. The way the door opens and closes, there is a hinge, there is a joint, and so that is what is called as the hinge movement. The second movement, it is the gliding movement. It is the gliding movement, right? So when things they glide like this from forward to backward, it is the combination of both these movements which leads to formation of temporomandibular joint movements. That's how we open and close our mouth. Okay, so here it is. See, this is the other part of it. What we saw above was mandible. Now what we are watching is temporal bone, right? So this is the depression. This is the fossa, right? That is what is called as the mandibular fossa over here, right? Because mandible would be connected over here. So this is mandibular fossa. So that is fine. But say if this is 1, right? This is 1 for the condyle, right? See, there is second surface, right? Which we can see it something like this. It is because of that articular tubercle, and that's where things would glide. So here, one would be utilized for the hinge movement. This would be for the hinge movement, right? And this second one, that is because of that articular tubercle, that would be for the gliding. Now we'll see this even in intact joint, then we'll dissect the joint, right? And we'll actually see that where exactly are all those structures which we talked about, including the articular disc. Okay. And yes, obviously this is temporal bone, right? We are dealing with the temporal bone. That's the intact TM joint, right? We have not yet disturbed it at all. We are about to open it. So this is intact TM joint. See what we talked about. The capsule is thin and loose when the movements are to be performed. So this is the capsule, right? That's the capsule. That's the capsule. And this capsule is loose and thin. So that's the reason it is possible to protrude, right? Protrude the jaw, side to side movement, right? While chewing. But then the support, right? It is this support. It is this lateral side. This lateral side support is strong. So that is where there is lateral ligament, right? So because of that lateral ligament, only on the lateral side, it becomes thick, right? It becomes thick. Otherwise, it is pretty loose. So let's cut this. Let's cut a small portion. We have not cut the entire TM joint, right? It is like we just want to create a window. So we just created a window. And through that window, when we see, so here it is, this one. That's the articular disc, right? That's the articular disc. So we do have the top portion, that is the temporal bone, right? Very fine. We do have this lower portion, that is the condyle, that is from mandible, right? Very good. But then in between there are chambers, there are cavities, right? So that is what we were interested in. This is the upper one, right? That's the upper cavity, and this is the lower cavity. So this is how that articular disc will be playing its role, right? This is a dense fibrous tissue, and that's how it will be giving resistance. Here we have as such straight away that articular disc, how it really looks like. So that articular disc has been dissected and taken apart. So this is how the articular disc looks like, right? And if when we try to watch it from the top, here it is. This is how it is, right? The idea is, say this is thin in front, right? This disc is thin in front, and on the back side, right, thick in back. But whatever we say, the best part is if you try to push it, this is highly flexible, right? This is highly flexible articular disc, right? So this is something which remains in between. So this is the hinge movement, right? So hinge movement, this, right? So that's what is happening over here. This is the hinge movement. Simply open and close, right? Just open and close. In fact, opening and closing, that would lead to combination of movements, but just this is for understanding. Only at that point, if it is happening, it is hinge movement, open and close. And this is the glide movement, right? Forward and backward. So that is the gliding movement, right? We have already talked about it. So that's the gliding movement, front and the back. Now see, the disc, right? Just a zoom thing. That's the condyle, right? No doubt about it. And then there is a fluid, and this is where this hinge movement is going to occur, right? So it is this hinge movement, it occurs over here. Hinge movement, which is classically between disc and the condyle. Between disc and condyle, that's where the hinge movement occurs, right? Between disc and condyle. And that's the gliding movement, right? So this gliding movement is between temporal surface and the disc. So here it is the temporal surface, correct? That is the temporal surface, temporal bone. And it is this disc which glides. So that is the disc. So here it is for gliding movement. So think it like this. When it is the gliding movement, right, then the whole condyle is taken in front. See, this is condyle, right? So then this disc will take the whole condyle front and the whole assembly forward and backward, right? And then when only the hinge movement, so that hinge movement would occur over here, right? All right. As such, when we chew, when we speak, it is combination of all of them. Now, if you really want to feel it, right, it is like you must feel it. Say, you know that prominent, right, this is what is called as the tragus, right? That is the just external, just in front of the external auditory meatus, the piece of ear which is that prominent part that is called as tragus. And just in front of tragus, put your finger and open and close your mouth, right? You'll be able to feel the movement of condyle, right? So just in front of tragus, right? Feel it. Open and close, and you'll feel that how the condyle actually moves. So you'll be able to feel it. That's right. It is like protraction and retraction. Very right. It is like protraction and retraction. True. Fine. So that's where you feel the condyle. All right. Now comes the all those fantastic fours. Yeah. There are 4 fantastic muscles. Fantastic 4. Divided into 2. Group of 3 and group of and 1, right? We can't say group of 1. So this is for to close the mouth, and this is to open the mouth. See, 3 muscles closing the mouth, so obviously they'll be powerful, right? They are powerful. And this one, this is just to open, right? It is bit delicate. So it is delicate. Small muscle. But it is a very shy muscle, right? So not easy to see. So let's start with that. See, for the opening of the mouth, one is the gravity, right? So it is the gravity which helps. Right? All boys would agree that sometimes they just मुंह खुला का खुला रह जाता है, right? You know the reason why. Okay, so this is one, but then there is another muscle, right? This is the gravity which helps. This is lateral pterygoid. Let me write it again properly. Right? This is lateral pterygoid muscle. Now, for the sake of understanding, what I have done is we'll keep on recreating the image, right? So right now there is only one muscle we have put. Then we'll put the second muscle, third muscle, fourth muscle, right? So that's how we'll keep on building up the entire concept. So that's a lateral pterygoid, this one. But it's seen that it is divided into 2 parts, right? There are 2 parts. So I'll just write 2 parts. Just keep it in mind that there are 2 parts which we are supposed to see, right? And those 3 powerful muscles, right? They are monstrous muscles. So their names are also like that. See, one to we talked about, right? That monstrous muscle, masseter. And names, look at the name, right? Temporalis. And this one is medial pterygoid. Right? Bit of Sharif name, but otherwise the rest of the names they are like Gundas. But they are so powerful. So right? So medial pterygoid, temporalis, and masseter, and this is the lateral pterygoid. And we are watching the lateral pterygoid first. But one thing you must have noticed, in order to see this lateral pterygoid, we have removed so many structures. Otherwise, this particular area is properly covered. Now, because it is a graphic, that's okay. We made the mandible transparent, right? And we adjusted the angle. What about real life? If we really want to dissect it, see, so many things are to be removed. Otherwise, we won't be able to see this structure. So over here, first look at this bone. We have removed what? Zygomatic arch, right? Because back over here, right? See, the zygomatic arch would be over here. So we remove that, then and then we'll be able to see all the parts of lateral pterygoid muscle properly. So here it is, the first thing. We'll write that zygomatic arch will sacrifice, right? Zygomatic arch sacrifice. Also, we need to say this is the condylar process and there would be the coronoid process. So we need to cut the coronoid process also. Coronoid process of mandible, right? Why so? Let's watch. See, here we made it transparent, right? But otherwise, see, that's how it is there. That's the coronoid process completely overlying this muscle. So we sacrificed that also. Okay. And when we cut this, what we are watching? We are watching straight away the infratemporal fossa, right? And this structure is none other than lateral pterygoid plate, right? Then between lateral pterygoid plate, there would be pterygoid fossa, and then there will be medial pterygoid plate, correct? So let's add, here it is, here it is. See, this is lateral pterygoid muscle, right? And this is lateral pterygoid plate, right? Here it is, lateral pterygoid plate. Now, now say, to be honest, what really happens when you dissect, right? There would be muscle. So you take a photograph, then you remove that muscle, you take another photograph, right? So here it has been done ulta, just to show first the lateral pterygoid plate, and then obviously muscle won't grow, right? Here it is, here it is. This is the muscle, right? So first this photograph was taken, and then this was, you know, those before and after, right? How those advertisements are made. Arey, you do this exercise, you do that exercise, and then from 90 kilograms you become 65 kilogram, right? Before and after. But in fact, in reality, they are ulta. The person is already of 65, one photograph is taken, and then he eats, he becomes 90, and then they are reversed, right? Before and after. Okay. Chalo. But here it is for our benefit. Now, this is the lateral pterygoid muscle. Now, in this lateral pterygoid, now we can see that there are two parts, right? This is the above part, this one is the below part, right? This is as such a small muscle. Now, its mechanism is superbly interesting, very interesting. How is it that such a small muscle, it really helps in opening of the jaw, right? In order to understand this thing, there is the mechanical system, right? How it is, let's say this is a pen, right? And if some muscle is attached like this, right, like this, so when it contracts it will do it like this. So this is the jaw, right? When this muscle contracts, right, actually it will be tilting it. So same way over here, right? This is the whole jaw, this is the whole jaw, right? And that muscle, when it contracts, right, so it takes this surface near, so this drops, right? So that's how it opens it, right? So though this is a small muscle, but that's how it works. On gravity helps. And that's why I was telling that, do remember that there are two parts, right? This is the origin, this is the origin, and this above one, that is where, this is the greater wing of sphenoid, right? Greater wing sphenoid. And this lower part from where it got its name. lateral pterygoid plate. So now we know this muscle so well, so we'll just write lateral pterygoid plate, right? But here we need to add something because this lateral pterygoid plate, right? Plate means it is like this. So there are two surfaces. One is the outer surface, one is the inner surface. In this case, we'll be telling lateral surface and the medial surface. We'll write lateral aspect or the lateral surface. It means definitely there will be someone who will be connected on its medial surface. Yes, right? It will come. So that's how this is the origin. What about C? Yeah, much better image, right? When we are watching it absolutely literally, see this one. This is the upper part, and this is the lower part, right? We are watching it laterally. So in this is the lateral view, correct? Lateral view. And focus is lateral pterygoid muscle. Let's rotate the whole thing so that we watch it from the medial aspect, right? We watch from the medial aspect. What should we expect? Because see, we should expect one thing, that is where these fibers are going, because over here things are, see, there are bones, right? These are the bones, everything is obscured, we are unable to see the thing, so that's where we'll be able to see it. So here it is, here it is. Orient yourself very properly. That's the muscle, right? This one is lateral pterygoid, lateral pterygoid. Well, confusion. Everything looks so similar. Not really, right? Immediately you will know that yes, 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 these structures, so I know very well. You know it so well. This is medial pterygoid plate and this one is the lateral pterygoid plate, right? This is the medial and this is the lateral pterygoid plates, right? Looks familiar. And in between this fossa, in between, that is the pterygoid fossa. And we said that this lateral pterygoid muscle would be emerging from the lateral aspect of the lateral pterygoid plate. Right? So true. And this is the reserved area that is for some other muscle. So that's the lateral pterygoid muscle. Once we have identified this muscle, it is going where? See, it is going like this. That's where it is getting inserted, right? That's the insertion. So it means insertion is small. It is just at a small place while it is emerging from a bigger area. Advantage is when the surface area is bigger and then it is focusing on a smaller area, that means all the lines of forces would be say converging at that point, thus generating much better power, right? To see this thing, here it is. Again, this is the mandible which we are watching from inside. So we have literally split the mandible and we are watching from inside. This is the insertion. That's where there is insertion of lateral pterygoid muscle, right? What is this? This is condyle, correct? This condyle on top of it is busy, right, with TM joint. But it is this condylar hollow, right? Hollow. It is the hollow of condylar process. That's where it is working. That's where the insertions are there. Right? What sound is coming? Anyway, so that is the insertion of lateral pterygoid muscle. That's where in the hollow of condylar process. Fair enough? Okay. See this. This is very interesting. It is not only attached at that hollow of condylar process. But see, there is the capsule, right? So I'll be writing in capitals plus. Lateral pterygoid muscle will also get connected on the capsule of TM joint. This is the advantage. That is when the mouth opens, so it will also pull the capsule, right? Plus, that opening and closing of the mouth was between that, even articular disc was involved, right? Condylar process and the articular disc. So it is connected on the front edge of articular disc also. So this is the reason why everything becomes so easy, though it is a small muscle, but so important. And that's how, say, this is where it is attached. See the disc, right? All these windows, it is showing that this muscle is where it is connected to even the disc over here, right? It is connected to disc. So that's how, why the dissection was done like this. This is all-time great, stylish styloid process. And she's about to appear with some important structures, right? All right. Now comes all those monsters, right? Just the look itself is, right? So he is medial pterygoid muscle. See how monstrous, right? Literally large. So that lateral pterygoid was so cute, so delicate, and see this muscle, so big. Because his work is to close the mouth. So where it is attached, first thing first. Since long we were talking about this, right? So this is say in this case, this is lateral pterygoid plate. This one is medial pterygoid plate. Over here there was lateral pterygoid muscle. So it is this particular area. That's what this is. Pterygoid fossa, right? That is the pterygoid fossa. That's where the medial pterygoid is going to get attached. So this is medial pterygoid muscle origin, right? Fine. Not only that, there is, as you rotate, right? As you rotate, you'll find that it is connected at some other point also. That is the corner of maxilla. So this is where it is some portion into the maxilla also, because those pterygoid plates, etc., they are of sphenoid, right? So it is connected on sphenoid and the maxilla, right? That's the sphenoid, that is the pterygoid fossa, and the maxilla. That's where it is attached. It means it has got a strong base, and from there, those big fibers, they start. Here it is. So we are adding into this our graph. So this was that lateral pterygoid, and here it is the medial pterygoid, right? Over here, mandible has been made transparent. Right. See, that's the inner aspect of angle of mandible, right? You remember we said that this is angle of mandible. See, all those names will now start appearing. Angle of mandible. Angle of mandible, it was like there was outer aspect and inner aspect. Both the aspects, they were rough. So here, this is rough, right? Which aspect we are talking about? This is inner, right? That is inner, right? This is inner aspect. It is rough simply because of this is the insertion of medial pterygoid muscle, the first candidate who is responsible for closure of the mouth, right? So that's the insertion. Angle of mandible, inner aspect. Now we need to talk about second muscle, right? The second muscle was, in fact, muscle number 3, but second muscle to close the mouth, and it is temporalis, right? So once again, we did some magic and we called up that coronoid process, which we sacrificed back, right? So we have put that thing back. So here it is that coronoid is back, right? Why we have called him back? Because that's the place where temporalis will be landing, right? So this will be the landing area for temporalis, in other words, insertion, right? Put it into simple words, it would be the insertion of temporalis, and we would like to see that how it really gets inserted. So here is temporalis, right? Literally that gunda feeling is coming up, right? Look at that lateral pterygoid and look at this muscle, right? We have to even write it like this, right? Temporalis, the largest muscle for mastication. Mastication means chewing, right? Largest muscle. This is like a fan-shaped muscle. It means its origin is on a wider area and it would be inserted at just one point, right? At a narrow point. So again, the same principle. All the fibers, they will be exerting pressure on just one point, right? And which point could it be? Right? This is like all the way, this is all the way that origin. And the insertion is same gentleman whom we called back, right? Coronoid process. So it will be inserted on coronoid process. That's the importance of it, right? That's the thing. So this is where the temporalis be inserted. Temporalis inserted here. But see, this is the beauty of these muscles, right? How thoughtful that Almighty must be when he must be doing this entire craftsmanship, creating those muscles. This is a very delicate bone, right? Coronoid process is not as strong. So it won't be very right if it is attached on one point. So this is like outer appearance, right? So this is outer aspect. Outer aspect. How powerful would it be if the muscle goes on the posterior aspect also, so that the entire coronoid process is pulled up, right? And that is what really happens. Here it is, this is the outer aspect, and watch from the inner aspect. This is the inner aspect. So that's our coronoid process, right? So from the inner aspect and the outer aspect, both the ways, right? This is the temporalis rules over here. Not only that, this is what ramus, so it is the coronoid process where it is connected, and also to this ramus. So thus giving extra strength. So it is connected to the ramus, but ramus on the interior side, right? So that's insertion. So now we have added third muscle, right? So that one was, now see how delicate that lateral pterygoid is. It was not looking as delicate in the initial stage, right? But now when we are comparing it, we know that this is lateral pterygoid muscle, right? This one is medial pterygoid muscle, correct? And this third one is well known, that is temporalis. Right? And this temporalis muscle is going to fill the temporal fossa going all the way, and it goes down. See, this is how when we watch from the top, right? This entire muscle, this temporalis is just temporalis. Huh? That's the zygomatic arch, right? So it is inside the zygomatic arch. See, inside the zygomatic arch. That's the zygo, right? So it is inside it, and it occupies that entire infratemporal fossa, big muscle. And just before insertion, right, it is thickened because all the fibers, they are converging. And this is, because it is important, so this temporalis, it is covered by a specific fascia that is called as the deep temporalis fascia, right? So that is deep temporalis fascia. So where would it be attached? All the way it is attached to the bones, right? So that's what, that is the temporal line, right? And then this one is the zygomatic arch, so all the way to the zygomatic arch. So it is connected to temporal line, all the bony connections, and the zygomatic arch. So it means that this particular muscle, because it is big, it is quite properly packed into that fascia, right? So that's how it really moves. And here it is, the final one, and he is masseter. Thick, powerful muscle, right? Very powerful. And all those cricketers, all those celebrities, right? They keep on chewing the chewing gum, so that's why their masseters, they are so powerful, right? Watch Terminator, right? Arnold Schwarzenegger with powerful masseter, you can see that. Now that masseter, right, over here, right, when we are watching, see, it is actually so powerful. Right? This is just another view. That's where it is attached, right? Zygomatic arch, right? It is, see, it is landing from, it is picking up from zygomatic arch. That's the zygomatic arch. So from zygomatic arch, it is just going down, right? Now see how thoughtful, again, that craftsmanship. Zygomatic arch, right? Zygomatic arch. Some comment came. Bulldog muscle. So, so that zygomatic arch, actually bulldog muscle. Well, let me write it. It really looks like that. Right? Bulldog muscle. So zygomatic arch, right? One is the outer aspect, second is the inner aspect. Now think it like this. Zygomatic arch is a hollow, a delicate structure, right? There is hollow portion inside, hollow portion outside, right? So this muscle, it hangs from that zygomatic arch like that. It means it would be emerging from outer as well as inner aspect. So here we are watching it from the outer part, right? Outer aspect. So in outer aspect, there are so many other things to be taken care of. So only the anterior two-third of zygomatic arch is taken, right? So anterior two-third. So what we are talking about is origin of masseter, right? Origin of masseter is what we are talking about. Anterior 2/3 of zygomatic arch, outer aspect. Let's go to the inner aspect. Here it is, right? For that inner aspect, we have to literally destroy the skull, right? Just to see this bone. So we have cut it like this. And that's where we see that the inner aspect, it is the full length of zygomatic arch all the way. That's interesting, right? So this is the inner aspect. Inner aspect. And in inner aspect, full length all the way of zygomatic arch. Right? Thank you. Now see, the masseter, when it is coming from the top, right? Visualize it like this, as if this one is the zygomatic arch. How to visualize this? If you cut it like this and then remove this entire portion and then watch it from here. Right? So in that case, zygomatic arch would just look like this smaller one, small one like this, right? Okay, I'll just keep it like this so that we get the reference. And then from both the sides, the muscles, they are coming up, right? So there would be muscles, they will be coming like this from the inner aspect, and then there would be muscles which will be coming from the outer aspect. Outer aspect, correct? Because they are coming from both the sides. So if we really want to name them, this is inner, right? This is inner, this is outer. We are watching from here. So we'll say this group is the deep and this group is the superficial. Correct? Deep group and the superficial group. But all of them, they are landing onto the ramus of mandible. So that's where it comes like this. It is like this. These are where the deep fibers will be landing. These are where the superficial fibers will be landing. So superficial fibers, they are from the outer aspect, deep fibers from the inner aspect, and they will be coming over here. And this is angle of mandible, correct? Right. So that's where this is what we are talking about is insertion of masseter. Insertion of masseter, right? So that's how these muscles, they actually work, right? So we talked about 4 muscles. 1, 2, 3, 4, right? The lateral pterygoid, medial pterygoid, temporalis, and the masseter. Group it like this also. Temporalis and masseter, right? They will be generating pressure from outside, right? So this is that upward pull, because see, temporalis and masseter, they both are connected over here in big. So that upward pull, the powerful upward pull is by number 3 and number 4, right? Temporalis and masseter. And when it comes to, say, this, right? The gliding movements, right? That is where that medial pterygoid muscle will come into picture, right? So it is this medial pterygoid muscle, because this medial pterygoid muscle will be operating from behind. So can we think something very important? The angle of mandible, as we said, that once again, let's draw this is angle of mandible, because it's like we are just watching from posterior, right? So on the medial aspect, right? So this is like, let's say this is medial, this is lateral. So on medial aspect, there were big muscles, right? That's what we saw. That is the medial pterygoid muscle, correct? And who was on the outer side? That was masseter, right? Masseter. Because see, right, this is masseter. And this masseter was coming from both the sides of the zygomatic arch, right? From the inner and the outer, and all the fibers, they are landing outside. So that is on the lateral aspect, right? So again, this area has been made powerful. Angle has been made powerful. So that's where the whole angle that is pulled up. So it means automatically it will be generating the power, right? So this is how these muscles they are arranged. These four fantastic muscles, right? So this is opening, right? That is the opening. What we said that it is by gravity and lateral pterygoid muscle, right? That is for opening the mouth. So one, gravity. Second, lateral pterygoid muscle. And just opening that occurs at TM joint, right? TM joint, to be very specific, between articular disc and condyle, correct? And when it comes to the sliding movement, that is occurring at the between temporal bone and the disc, right? That is for the gliding. Okay. Now we add those two ligaments, because see, if things are so free, so then the entire jaw can go very much into the forward position. It is necessary to restrict the forward movement of the mandible, right? So to keep a check, to restrict forward movement, or we should say excessive forward movement, right? Excessive forward movement of mandible. These muscles, we should deploy ligaments, right? Because ligaments, they are something which can give real good strength. So here comes long awaited, right? The styloid process. This is the styloid process, right? That's the styloid process. Was waiting since long. And this is what this is. Yes, that is angle of mandible, right? Angle of mandible. So that's the ligament, this one. We need to give name to that ligament. So very easy. Stylo mandibular ligament, right? So that's stylomandibular ligament. This is the first ligament which will be restricting the excessive forward movement. So that is first. So that's why we were remembering styloid process. Angle of mandible has got now so much of importance. Outer, inner, right? Now the even ligament is attached. We remembered two more structures. One was the spine of sphenoid. That's the level, that's the location of spine of sphenoid. Spine of sphenoid. Okay. And then on the inner aspect of mandible, there was mandibular foramen, and then there was one protrusion, right, which we called as lingula, right? We called it as lingula. So that was there, and we called it lingula. Not, let's write out. So that's lingula, and what is connected in between, again we have to give a name, right? So this is like spine of sphenoid it will say forget, right? Sphenoid is sphenoid. So it will say spheno. Mandible feels when the sphenoid bone, when the spine is also so good-hearted and sacrificing its name. So here Lingulus will say, I'll also sacrifice my name. Means mandible is mandible. So this is called a sphenomandibular ligament. Right? They both are not fighting for those smaller structures. So that's why sphenomandibular ligament. Right? From bone to bone. Right? So these are the two important ligaments which will be restricting the excessive forward movement of the mandible. Now introducing the hyoid bone. Now it is so small but very important. It's a U-shaped bone. U-shaped. In fact, this is the bone which is not attached with any other bone. Right? This is literally suspended bone, right? It is a suspended bone. So not attached with any other bone. And if you just put it, you can really move that bone, right? You can move it, you can feel it. So that is the hyoid. What is its function? What is its importance? Importance is so good. It holds two things. One, when we'll be discussing the tongue, that tongue is just above it. It is just above this hyoid bone. And the voice box, that is the larynx, it is just behind. It takes care of both of them. And today we'll be watching 7 group of muscles. Again, it would be a fantastic journey how those 7 muscles, they are connected with each other, right? Where the hyoid will be playing a major role. So this is where it holds. That's the importance of this hyoid bone. Now just by looking at it, we know that this is the body, right? That's the body. That's a lateral side, lateral aspect or the lateral view of this. And now we are so expert in giving the names, immediately any of these extension, right? And it looks like the horn. So we'll call this greater horn, right? Greater horn. And this one would be the lesser horn, right? Lesser horn of hyoid. It's also called as cornu, right? It's also called as cornu. So greater and lesser cornu of hyoid bone, right? Just another view. See the body. That's the body. Looks rough, right? Rough. And if it is rough, there can be only one reason: muscles would be attached. But these all muscles, they are pretty sharif. Pretty sharif, right? No complications. Straight away to the point. See? So that's the anterior view, right? This is the anterior view. And this one would be the posterior view. True? Posterior view. So this is the inner aspect of body. Even that is rough, right? That is rough. Same reason there would be so many muscles, right? Beyond doubt, so many muscles would be appearing over there. Now, see, these are the images, but when it comes to real, this is a real hyoid bone. One marked difference which we'll watch. That's fine. This is the body which looks so rough because muscles are connected. This one would be the greater cornu. That is also fine. But watch this. It's not fracture, but it is a synovial joint, right? It is a synovial joint between that greater cornu and the body. And that's the reason it would be giving some movement. Some movements they will be possible. Right? So that's the synovial joint. And this is the location. Right? In this we would like to just, we know that okay, this is the hyoid bone, above is the mandible, right? All good. But the level is the last molar tooth level. Sorry, last molar tooth level. That's the level where the body is. Where the body is. So it is the level of last molar tooth level. That would be where the body would be. Now I know your imaginations would start. This is, we are now about to start a very interesting thing, muscles of hyoid bone. Muscles which are associated with the hyoid bone. And then there are 7 pairs. Right? 7 pairs, 7 muscles. All of them, they are so beautifully connected with each other that it is like literally like music, saat sur. Right? You know one, automatically second would flow to third to fourth, and you'll know their structures, you'll know their functions automatically. You don't have to remember, right? Everything is in the form of image. Okay, so first thing first, the first muscle coming up, and it is Myelohyoid. It is Myelohyoid. This Myelohyoid is forming the mobile floor of oral cavity. The entire oral cavity's floor is formed by this Myelohyoid. So important, right? So, floor of oral cavity. And this is the muscle. This one is hyoid bone, right? That one is mandible, right? So that's how the mandible and the hyoid bone, right? So this is how it is there. Now let's see it from another angle. This gives much better clarity. So here it is our mandible, right? And this one is hyoid bone. Okay? And this one is Myelohyoid. See, Myelohyoids from both the sides, they are converging, right, onto the hyoid bone. That's where they emerge, right? And so this is the origin of Myelohyoid. Right? This is the origin of Myelohyoid, and then from here they go towards the body of hyoid bone, right? So that's how it emerges. So this is the origin. I think perhaps maybe while describing mandible by mistake, I think I showed Myelohyoid over here. If it is there, I'm sorry, right? Just maybe. That's what I remember. Perhaps I showed Myelohyoid here. In fact, it is over here. Anyway, right? So here it is like Myelohyoid, right? And that's how it is connected to inner aspect, right? This is the inner aspect of mandible. And this is the insertion. This is the insertion of Myelohyoid. So from inner aspect, right, that muscle would be forming like a floor, right? That's how it would be forming the floor, right? So that's the insertion. Right? No one commented on these images. Doesn't it look like that a bat is dancing balle balle? Right? See the wings of the bat and then doing like this. So first muscle was Myelohyoid, this one, and the second muscle which is coming up over here, it is Geneohyoid. Right? Everywhere that hyoid name is going to come. So this is Geneohyoid. This Geneohyoid is this. That one is Geneohyoid. So from the lower part of mental spine, right? You remember inside of the mandible we called it spine, mental spine. On the outside it was called as mental protuberance. So this is mental spine. So this is mental spine. From that's where it would start, and end will always be on the mandible, right? So two down, two muscles down, five to go, right? So that is Geneohyoid, right? So easy, right? So this is Milo H, that is Myelohyoid, and this one is Geneoh, that is the Geneohyoid. One, two. Now think it, both these muscles, right? They are connected on the anterior surface, right? They are connected. If this is the mandible, right? If this is the mandible, they are connected anteriorly, and here is the hyoid. So they are actually connected like this. Right? They are connected like this. So when they would contract, what will they do? They will pull the hyoid bone forward, and because they are connected at a higher level, so when they will contract, they will also pull it up. That's the function. That's the function of both Milo and Genio. They pull hyoid up and forward. Right? Not at all complex because they are just connected to the jaw, right? The jaw, the inner aspect, and the hyoid is back. So that's how it pulls. So two down, right? Okay, this one. Now they are so interesting, right? Every muscle has got some speciality. So let's call this styloid process first. So this is our styloid process. That's the styloid process. So styloid process tells that chalo, I also send something, right? So styloid process is sending a muscle all the way to hyoid bone. So obviously the name would be Stylohyoid, right? See, I told you all the names, they are very Sida Sada. This is styloid, right? So obviously this is very stylish, long, slim muscle, right? So its origin would be, it will start all the way from the lateral aspect, right? Because everything is going out. So this is the lateral aspect of styloid, correct? And then insertion, that is on the greater horn of hyoid bone. So if this was the body, this was the greater horn, this is the location. That's the location, right? So that is the base of greater horn, obviously of hyoid, right? No need to write. So that's where it is attached. So this is the stylohyoid. Now before we go for that stylohyoid, we need to see this thing in bit zoomed version. So this is fine. Myelohyoid. This is also good. That is Geneohyoid 1, 2, and this one is Stylohyoid. But this Stylohyoid over here, this muscle splits. It is to give way to that one big muscle which is called as the digastric muscle. Now, before we proceed for the digastric muscle, if we really look at it, look at this muscle, unzoom, now full view. See here, this muscle is connected posteriorly, right? So if we see that this is the TM joint, the styloid process and the mastoid process, they all are back. And over here, there was the jaw. This is the hyoid. So Myelohyoid and the Geneohyoid, they were like this, and Stylohyoid is like this. So it is a sort of jhula, right? So when this Stylohyoid contracts, it will, what it will do? It will pull the hyoid up, and this time it is on the back side. So it will pull the hyoid up and it will pull the hyoid back, right? So this is up and back, and that's what Myelohyoid and the Geneohyoid were doing, up and front, right? Simple as that. So that's how this jhula is created, right? Back, forth, that's how it moves. So 3 muscles down, right? 4 to go. Yeah, see, that's how it really looks like, right? Now in this, we need to see 2 things, that it is an amazing combination of digastric and stylohyoid. Very, very amazing combination. See what it does. First, I'll highlight, because this is the last thing which you have to understand. But from this point onwards, so things are like straight lines only. Yeah, actually, they are like that, right? So this is a muscle, right? This is a muscle which splits. That's what we saw, right? That's what we saw in the previous image, that stylohyoid, it splits. So this is the stylohyoid, it splits. And then there is another muscle which is a digastric muscle. And this digastric muscle, this is one Bailey. Then there would be the tendon, right? That tendon would pass between this, and then there would be another Bailey, right? So this is the muscular part. This one is muscular part, and this one is tendinous part. It is this tendinous part which is passing between that split of stylohyoid. And for the better pull, there would be some fibrous sling, fibrous pulley type of thing, so that tendon, it can really move easily, right? So this one would be the posterior Bailey, and this one would be the anterior Bailey. We are talking about digastric muscle. Where it is? Here it is. The posterior Bailey. This one is the anterior Bailey, right, of digastric. And see, this is, here it goes. This is the tendinous part, right? Zoom. This is the tendinous part. And can you appreciate? See, that tendinous, that white structure, it disappears and then it reappears over here, right? See, just remove everything and now you'll be able to see. See how nicely that white structure which is over here, and then it reappears over here, so that it is passing through the opening of that's our stylohyoid, right? That's the stylohyoid, and it is passing between that, right? And then there is fibrous tissue sling over here. This is the fibrous tissue sling, which is acting like a lever. Now here it is. Zoom, and you will be able to appreciate. See, that's the posterior belly. That's the tendon. And this one is stylohyoid, right? And this one is fibrous sling. See here. Now this is seen crystal clear, right? Right? Now it is seen better, right? So this one is posterior belly. That one is anterior belly of digastric, and it is passing through this stylohyoid. And that's that thing, this one, right? That is the fibrous sling. Now where it goes? See, this is going, right? This is going, this is another view, right? It is going underneath. It is going underneath. This muscle is what? This is myelohyoid, right? That is myelohyoid. Myelohyoid, which was forming the floor, right? And this one is going still underneath. So almost at a very lower level, right? This is the jaw. This is the jaw, right? That's the mandible. So that's the mandible. That's how it is arranged. See how nicely this sling is there, which is used for the change in the direction of the muscle. See again, right? That's how it goes. Now it has to be very clear, right? Because this is such an important concept, so that's why I added few more images. So this is the posterior belly, that's the anterior belly, right? And that's the fibrous sling, and that's how it goes, right? Yeah. So here, that posterior belly, it goes up. So this is the origin, right, of that posterior belly of digastric. So that posterior belly would be emerging from pretty higher level. This is what? This is the mastoid process. So behind the mastoid, there is mastoid notch, right? So classically, we would write it as mastoid notch. And mastoid notch is on which bone? Temporal, right? So we'll write it like mastoid notch of temporal bone. Mastoid notch of temporal bone, right? So from mastoid notch of temporal bone, it goes down, right? Not only that, right? Even the mastoid process. See, the mastoid process is like this and this. So it emerges from here, notch, and the medial aspect, right? This is that aspect, this one. So plus medial aspect of mastoid process. From lateral aspect, there would be that sternocleidomastoid, right? Because from here, that sternocleidomastoid from the lateral aspect and splenius capitis, right? So over here, in order to see the muscles properly, we have sacrificed it. We have cut those muscles so that we are watching just this digastric, right? Now you can see the digastric so properly that this is the posterior belly, right? That's the posterior belly. That one is shining part is the tendon, right? Is the tendon, and this is the anterior belly, right? That's the anterior belly. And see, this is the fibrous tissue. This is the fibrous tissue, fibrous sling, which is to change the direction, right? And that's how. Wait. This is not posterior belly, has to be above, right? This is the tendon. My mistake. This is the tendon, right? And it is passing through this. So this one would be our stylohyoid. Now it is fine. Now it is fine, right? So that tendon, it goes and then dot, right? It is inside, and from here it emerges and then it goes. Yeah, now it is okay, right? That posterior belly, though, it would be much higher. So here we can see the anterior belly, right, of digastric. Okay. And then from both the sides, they come just underneath the mandible, right? So that's how from both the sides they reach, and this one is mandible, right? That is mandible. So that's the anterior belly, right? And which muscle would this be? That would be Myelohyoid, right? Which is forming the floor of the oral cavity, and just underneath this is the anterior belly, digastric. Now seen better, right? A complete idea. So in this, everything is seen fine, right? So that's the posterior belly, that's the tendon, that's the fibrous sling, right? This one is the anterior belly, and that's how they are connected. So their insertion, if we talk about officially, the insertion of digastric, it is just lateral to midline. Right? So over here, right? This is just lateral to midline. So that's the midline, just lateral, right? So that's where the insertion is, just lateral to midline. Now look at it. What will it do? This is connected to the mandible, and then it is going all the way up, right? But here it is the sling which is attached at the hyoid bone. Otherwise, from both the sides, right? On one side, and the sling and the mandible. So this sling is attached at the hyoid bone. So when it contracts, it will elevate the hyoid bone, right? It will lift it, right? So when hyoid will say, right, that lift kara de, that means that is where this digastric will come. So that was the insertion. So 4 muscles we talked about, right? The most complex part is over. Now so it is like all simple straight lines. So this was Myelohyoid. Myelohyoid up and forward, correct? Geneohyoid, well, they both are working in association with each other. So up and forward. Then we created that jhula, right? So that was Stylohyoid. Stylohyoid, which will be lifting up but back, right? And then came the digastric. So digastric will simply elevate, right? So 4 down, only 3 muscles, last 3 muscles to go. And we see those 3 muscles together, right? They are that simple. All are going down from the hyoid bone. So that's the hyoid, and all those, they are going down. So that's the reason collectively, all of them, they are called as the infrahyoid muscles. Now see, in the midline, we need few bones, right? We need few bones. So in midline, sternum would say that I am there, right? Sternum, right? Let's write it in the middle. So this is sternum would say, yes, I am there. And then on lateral side, scapula, right? Scapula would say that I am there. So this is scapula, and here also it is scapula, right? They are there. But that's it. So the naming process starts this muscle, which is going from hyoid to scapula. It is called as the omohyoid. Omohyoid. The muscle which is going from hyoid to sternum, same name, right? Sternohyoid. So easy. And then we have not touched one muscle, right? One structure, I should say, and that is thyroid cartilage, right? Which will come. But this muscle, and see, this is the posterior view, right? Remember, this is posterior view because from anterior view you cannot see thyrohyoid. So this is the small muscle. This is the small muscle. This one is thyrohyoid. So this thyrohyoid is from hyoid to thyroid cartilage, right? To thyroid cartilage. So these thyroid cartilage, they are like lateral plates from both the sides, and that's what they form this Adam's apple, right? That Adam's apple, that neck, that. So that's where those plates from both the sides, they are the thyroid cartilage. That's where it lands. So we have got 4 down, right? This is number 5, this is number 6, and that's the thyrohyoid. So done, right? Sorry. Omohyoid, sternohyoid, and the thyrohyoid. So these are the 7 muscles. Let's see this for better clarity. Centrally located, right? Medially located. So it has to be sternohyoid, right? It has to be sternohyoid. Then this one going on both the sides. So this one would be omohyoid. That one would be omohyoid. Rest all known to you. This one is Myelohyoid, right? That one would be in between. That one would be the Geneohyoid. Then this one would be, say, Digastric, right? And this we already talked about, Sternohyoid, and that is Omohyoid. And finally, this one is Thyrohyoid. Right? That thin sling above, that is the Stylohyoid. So here is, that is how we see all of them, right? What's the purpose of these muscles, these 3 infrahyoid muscles? Right? So these infrahyoid muscles, 1, 2, 2 functions. One, when the hyoid is elevated, they'll take it back, right? So they will depress hyoid, right? Physically, not from psychological point of view, right? They will depress or they will take it down after it has been elevated, right? So if elevated, that's very important. If the hyoid bone has been taken up, they'll put him back. And second, it fixes the hyoid bone position. Hyoid bone position. What it really means? It means that these muscles from both the sides, they will act and they will put it exactly into the center, right? So from both the side of the muscle, they will contract and they'll put it into center. So this is the common function of all 3. That is sternohyoid, omohyoid, and the thyrohyoid. But this thyrohyoid has got one very interesting function extra, right? This thyrohyoid only. Thyrohyoid, right? This is where the larynx would be there. So when hyoid bone is fixed, it will elevate the larynx, right? So it elevates larynx. So when we'll be discussing the formation of speech, at that point, this one would be the crucial one because we'll see the entire process, right? Which muscle is involved, how the larynx really moves, how the air is taken care of. So it elevates larynx, important, when hyoid bone is fixed, right? Because when hyoid bone is fixed, they will contract, and we just said that larynx is just behind it, so it will lift it. From the perspective of, say, if we say this is body of hyoid, right? That's the midline. So this is body of hyoid. One muscle. Now we are talking about this infrahyoid muscles only. So one muscle which would be connected on the inner aspect. So that's why I'm drawing it in with this type, right? A lighter shade. So this means that this is on the inner aspect. Inner aspect. And this inner aspect muscle means obviously it is on both the sides, right and left, right? This is thyrohyoid. Thyrohyoid is connected on, if we really want to describe, is connected on the inner aspect of the body of hyoid, right? Just lateral to the midline on both the sides, right and left. Okay. What about other two muscles? Right? So thyrohyoid down, we have got sternohyoid and the omohyoid. They are connected externally, so I am drawing them with bright color. Right? I am drawing it with bright color. So we have got the choice. Right? There are two muscles. One is sternohyoid and second is omohyoid. Omohyoid will be going towards scapula, right? And sternohyoid will be going towards sternum. So nothing more to worry about. Medial is medial, lateral is lateral. So this is sternohyoid. This one is omohyoid. That is where they will be originating, and then they go down, right? I like this figure, right? I don't know from where I got this. This I know this is movie, right? This is a movie, right? Fantastic Four. But see, these Fantastic Fours, somehow they are associated with all our mastication muscles, right? What is difference between Geneohyoid and anterior belly of digastric? Well, anterior belly of Geneohyoid and anterior belly of digastric muscles, they are acting as a sling, right? They are acting as a sling. So it means it will raise because its connection is higher up, much higher. It is into the maxilla, right? So that's where it will be pulling it up, digastric. When it comes to geneohyoid is just a connection, small delicate muscle which is connected between mandible and the hyoid bone, right? So it is a very small delicate muscle. Digastric is much powerful because digastric has got that sling, so it will lift the whole hyoid one, right? Yeah, so this is Fantastic Four, and if we really want to give name, the easiest thing, yes, that's right. So easiest thing is we'll give her the name of our first one, right? Sue Storm, right? That is lateral pterygoid muscle, right? Makes sense? Very delicate, right? So Sue Storms storm is lateral pterygoid muscle. Okay, the biggest one, right? So it would be this, right? Ben Grimm. So that is temporalis. So Ben Grimm is our temporalis, right? Looks wise, yeah. So, right, this is second muscle. And regarding the masseter and the medial pterygoid, right? We can really see this, right? So lateral pterygoid here. So let's write that medial pterygoid over here, right? Medial pterygoid over here, and this Johnny that would be our masseter, right? So this is 3, that is 4, right? So that these are our fantastic 4 muscles. If this is the thing, now watch for this. Again, this is so cute. All those 7 dwarfs, right? And these 7 dwarfs, again, they are our those 7 muscles, right? And all of them, they are special, right? They have got the name. Say this one is Doc, right? With identification, that's spectacles, right? This one is with those high eyebrows, so this is Grumpy, right? With those high eyebrows. Then always sleepy, this is Sleepy, right? This is Sleepy. Then this one in between, that is Bashful. And these 3, right? This is always happy, and this one sneezy, nose, right? This is sneezy, and finally this one is dopey. Regarding our muscles, right? Those muscles, this middle one, right? Middle one, we call it, say, Myelohyoid, and Myelohyoid is associated with a muscle who is not working much, right? Almost sleepy sort of thing. So he is Geneohyoid, right? And this Stylohyoid would be absolutely on the other hand, and it is this digastric which is in between standing, right? Regarding these 3, right? These 3, they are working in joint operation, right? This one is Thyrohyoid, and they both are, one who is medial, this is Stylohyoid, and this one would be Omohyoid, right? Done. All 7 muscles. Yeah, Snow White and the 7 dwarfs. That's right. So this was the story of mandible and hyoid, right? So this is the beginning now of the oral cavity. Thank you so much. And tomorrow we'll come up with the next topic. Saving this, and I'm putting it into our shared folder. Thank you and bye-bye. Good night and see you tomorrow. Bye.